Just give me a second because it's preparing to live stream the YouTube is what it says. Just give me a second.
No
Yeah, we're
problem.
live. So whenever you're ready, you can start.
I am ready. Greetings to all. We're about to start the meeting, and because of the level of COVID cases and the fact that we're still under a quote unquote executive order state of emergency, we are holding this meeting virtually. Members of the public who wish to comment to an item on the published agenda must submit their statement or question in writing to Mike Charlie, and we have his email address up there at mike.charlie@skokie.org. And all properly submitted statements or questions will be presented to the Board of Health members and made part of the record. Written comments also may be submitted and emailed to this public comments at skokie.org by mail. The Village of Skokie, attention Michael Charlie with the Skokie Health Department at 5127 Oakton Street in Skokie at 60077, or via the village's drop box located by the public entrance to the village. So I'd like to officially call the meeting to order and extend my good wishes to all. And I hope everyone's doing well and staying healthy at this time. Our first order of business, it would be the approval of the agenda. And we will do this as a part of the consent agenda. And so therefore, if I don't hear any objections, I will accept this agenda as submitted. Do me a favor, folks, because we're doing the share screen, I can only see about 6 people at a time. So use your electronic hand raiser, and that will bring you up to the top of the screen if you have a question or concern or a comment. Okay. The next order is to approve the minutes of the October 13 Board of Health meeting. And again, we'll accept it under the consent agenda. And again, if anyone has any objections, suggestions, deletions, punctuations, corrections, please speak up now.
I just have one comment, Dr. Lynn. So during the last meeting, I took attendance, but I failed to keep the attendance sheet. So if you attended the October 13th Board of Health meeting, would you please just put something in the chat or just let me know via email so that when I do post the approved minutes, I make sure I have the correct attendance. And I apologize for that inconvenience. I didn't mean to do that, but I just misplaced the actual document that I was checking off names. So I apologize. And for some of you, you've already responded, so thank you.
Thanks, Mike. And so we will make sure that the attendance is updated and correct. And so we'll just, again, approve the text of the meeting. And I'm not aware of any objections at the moment. I don't see any electronic hands being waved. So the next order would be my report. And, I want to make sure that we have adequate time because we do have some other things that may take a little time on the agenda. I guess the big thing from a public health perspective is that the nation right now is being overwhelmed by upper respiratory infections. You probably have, we're all very sensitive and aware of COVID, but we're seeing a kind of an early flu season. The good news is that the vaccine and the strains that are being detected is a good match. So we have to encourage everyone to be vaccinated. The other big issue is respiratory syncytial virus. And I can tell you that I've been on a lot of calls for the last couple of weeks, and Chicago is literally overwhelmed. Now, the majority of infections are in young children. And the younger the child, the smaller the bronchial tree is, if you will. And so the inflammatory response tends to cause a great deal of difficulty breathing in these children. And that's usually the reason that they are hospitalized. The other population that's very vulnerable are older folks, probably myself included. And the best advice we can give, because we don't have a vaccine yet, there's one on the horizon. We really don't have a therapeutic agent. There are a few in development right now. But the important thing is, maintaining a proper distance and, encouraging people that have symptoms, and especially kids, to stay home. And that's causing a big burden nationally because there's a significant number of individuals who are, caregivers, and they have to stay home with their children. So this is really a problem. The transmission of RSV is not well known. It's broken down into two groups, droplets and fomites. And it doesn't appear to aerosolize, unlike COVID. The R naught, or the infectivity, is 1 to 3. So one person will usually infect 3 other people, which is not nearly as contagious as COVID, as we know, or flu. I'm sorry, a little more than flu. So, we're just trying to get through this. And I know Michael talked about what's happening in Skokie. One little point that's very interesting is an article came out the other day in the New England Journal of Medicine, where they actually studied returning to school and the removal of masking policies. And this was done in Boston. It was an epidemiologist from Harvard, public health folks, and it showed a third of the higher in students that are in schools where masking was eliminated. And we've probably talked about this amongst yourselves, and I know certainly in the circles that I move, we've been talking about the wisdom of getting rid of masks. And again, I don't know firsthand, maybe Mike has a feel for what's going on in Skokie in terms of our schools. But that was the big fear when people would start to return. And that's actually one of the reasons why they're talking a little bit about why we're getting a significant flu and RSV season, is because masking and isolation and separation and all the things that were done to mitigate for COVID over the last 2 years has probably created a situation where you have a lot of young people who weren't exposed. And now they're seeing the virus for the first time, and they don't have any native immunity. And so they're getting a more severe type form of the disease. So Mike, can you put the agenda back up? I also want to welcome Sybil Yao to her new role as the vice chair. I did receive confirmation today. I got a letter from Mayor Van Duzen that Sybil was appointed by himself and the board of trustees. And I welcome the assistance, and I look forward, because I know Sybil has some things she wants to talk about. Now, Sybil, I'm assuming you want to talk about the next agenda item, which is the member introduction, because this was something that we had discussed in anticipation of this meeting. So do you want to set the stage, Sybil, or do you want me to?
Dr. Lynn, can I ask a question first? Please?
Sure, Maureen.
It's related to the topic. What is the procedure for nominating, and does the board have anything to say that we don't vote, we don't talk about this, about putting people in new positions? The mayor is the decider?
Yeah, under the village code for, for commissions, and actually the Board of Health is kind of looked at as a commission. All commissioners, all chairs and vice chairs are appointed by the mayor and the Board of Trustees.
I don't even know the mayor. I've never talked to him. How did he appoint me?
Well, you must have applied.
I did apply.
I'm assuming.
Yeah, I did apply.
So that
but
application, that application with your credentials and your interest went to the mayor's office. So
And that's
it would
enough?
have been and well, the mayor, then they decide, within and how they work together at the Board of Trustees. I'm not aware, but it goes through the mayor's office, and that's how it is in the village code. Okay, and it's for and this applies to all commissions. This is how it's done. That's why, we have people, that will, be filling spots, and we'll meet them for the first time and talk to them when they first arrive at a Board of Health meeting.
Can I?
Mike, do you have
this
anything to add?
The only
I'm
person
sorry?
I met was the former director. And that was after I was appointed. So it's a mystery to me how the caucus party controls all this stuff in the village without any input
Well,
from other members of the commission. I mean, Sybil is wonderful. I have no issue with appointing her in a leadership role on the commission, but my issue is, why aren't we consulted?
Can I add as well?
That's so let me Swapna, do you have a question?
Yes, I just want to kind of add to what Maureen mentioned. I think, thank you for clarifying the process for how the appointments are done. It'll be, in terms of transparency, it will be helpful for us to get more information on how the mayor and the trustees make the decision. I think it'll be very helpful for me to understand the process if we can at the future meeting.
Thank you. We'll look into that for you, and we'll probably make an effort to circulate the actual the code, if you will. The procedure is out. It is outlined. Okay.
Thank you.
I'll take one more question on this because I really want to move on. Okay, Pat.
I thought that the people who were interested in serving filled out the papers, and they were suggested through like Mike Charlie or Catherine to the mayor, and then the mayor sort of rubber stamped it. That was my impression over all these years. As for the administrative process of who the leaders are, that to me is a little bit more of a mystery, how they are chosen.
Well, actually, it's very similar. Mike, do you have any comments on that?
Yeah, so I can walk through just kind of communicate what I know about the process. And what I've learned is that the mayor reached out to me, and he asked me, he said, I'm considering with all boards and commissions ensuring they have a vice chair. And he asked me if there was anyone on the Board of Health that I thought would make an excellent chair. And then as I went through everybody's involvement since I've been here, I identified Sybil as being a leader, not only, within the Board of Health, but she's participating on the planning committee team. She's participated on the sustainability planning team. And I circled back with Dr. Lynn, and I said, look, is there anybody in particular that you'd recommend? And then he said that, everybody is qualified. And I said, what about Sybil? I said, she's done a lot of work as a Board of Health member representing different things. And I think she'd make an excellent candidate. and a great co-chair, and Dr. Lynn agreed. So then I circled back with the mayor. And the mayor had mentioned to me that he wanted to make the appointment by the first meeting in November, which was prior to when we were meeting. And to be honest with you, I knew he was on a timeline. So I knew that, and when Dr. Lynn and I took a look at it, and after Heidi, after you had mentioned something to us, I circled back and I did a little more due diligence myself, and we took a look at, I'm like, I wanted to know myself, is there any policy or process for this that I'm not aware of? And when I took a look at it, the ordinance states exactly what Dr. Lynn said, is that the village, the mayor has the authority under the code with the approval of the village board to appoint chairs and co-chairs. So other than that, I don't have anything else for the Board of Health at this point in regards to why that's the process or why he chose not to come back to the Board of Health, other than to say that's the process that he followed at this point. So I hope that helps. That's what I know at this point.
Yes, thank you. Thank you.
Thanks, Mike. And we will look more into this and see if there's any nuances or other things that we could share with everyone. But I was satisfied once I reviewed the code, and I made sure that it, to my satisfaction, it was following what was done, and we don't have a defined role in that. Heidi, I out of respect to you, I will entertain this one more question, because this is not on the agenda, so we really can't be discussing this and it's not an action item, but go ahead.
I'm sorry,
lost
this is
you.
not an action item, but in truth, you knew this was a concern, and so did Mike, so it could have been added. But my point simply is, you're absolutely right. Village code is the mayor appoints, but the mayor took the time to contact Mike. Mike took the time to talk to you. You all took the time to talk to Sybil, who I'm very excited about, by the way, and she and I have discussed this a lot, and I think are fairly on the same page. But that too would have been an opportunity to come to the board and say, hey, we're on a short timeline. It just in the interest of sort of transparency, because I learned about this from the consent calendar on the village board agenda. And so that just, to me, it was like, well, that's a surprise. One more time where we didn't get asked for input, not the first or the second or anything like that. And maybe this is an opportunity to begin to change that culture a little bit, but probably, Sybil will help lead a lot of that just by virtue of being who she is, and the cool spirit that she is. So that's all I wanted to say. Thank you for the time.
So back to Sybil, because I know you want. I'm assuming you wanted to lead this discussion because of our discussion. The next item on the agenda.
Right. Well, first of all, I kind of want to address everyone and just say that this all developed within a relatively short period of time. And it was definitely, an honor and a pleasure to accept the nomination. But I do understand that it was very much a surprise to everyone. And I don't think that you can't really do anything about that at this point. I do want to assure everyone that I don't take anybody's concern personally, that, someone is concerned that I won't do a good job or that it's not going to work out well for the board. So my focus is to be very open and honest with everyone. I would actually really like to get to know everyone. And when Heidi brought up the onboarding as an opportunity that she wanted to look into, I kind of think that a lot of us, because of COVID, don't really, and the meeting style, we don't really know each other at all. Of course, there's many of you that are on the board that have a long history together, and I'd like to learn more about that and why everybody joined and what their expertise is. And we are looking at some projects coming up. One is to expand the I-Plan talk and discussion, and I know we have to keep the number of people to 5 or less, I believe. But there's also the Medical Reserve Corps, because one of the reasons that the mayor, I think, is looking at very seriously is the opportunity to make sure that should there be another public health emergency, the board and Skokie will have the ability to meet the needs. So there's some good projects that we can actually involve different members of the board and engage people, because right now my sense is there's sort of a little bit of a disconnect to some of our activities, and I'd like to be the conduit that brings more of that together, because that's always been my forte, is to work well with people of diverse opinion and, come to a lot of consensus that's meaningful. So everybody's concerns tonight, I don't take personally. In fact, if I were in your position, I would have concern as well. So that kind of is a segue into this idea of board member introductions, and given the time that's it's about 7:25 now, so I'm not sure that we could actually go through everybody right now. I don't know, Mike or Dr. Lynn, what would you like to do now?
So can I jump in real quick, Sybil, if you don't mind?
Sure, of course.
So my preference for this, or my recommendation, is that first of all, I want to thank Sybil, and I want to thank Heidi for making that comment too. I don't want to go back to that, but I think, and I respect anybody's comment, and I don't take anything personally either with what Heidi introduced. So I just wanted to mention that. But I think with the Board of Health member introductions, first of all, we're going to get to the Board of Health onboarding document, but Heidi did an awesome job with that. I also think I want to get to know everybody better, but I don't know if we have the time, like at this meeting, to do it. So what I'd recommend is, Sybil has said that she would work on either surveying everybody or gathering information on everybody, and then coming up with some sort of a template so that we would have information on everybody that we can share with everybody. And then I think we could maybe bring it back to the meeting, and maybe we can focus just a single meeting on getting to know each other. And I would maybe even recommend we hold a meeting in person where we can actually look at each other and maybe get some food, and maybe, it can be a meeting still, but we can still make it. I think that our meetings don't always have to be public policy and process. It could be more getting to know each other in order to lay that foundation for future meetings. And I think all these ideas are really excellent ideas, and I really do appreciate Heidi and Sybil and Dr. Lynn working on these things. So that's my suggestion, my 2 cents, more like 10 cents maybe.
All right, Mike, that's a good idea. I know I saw something flash in the chat, Maureen, about featuring a member at each meeting. And I want to just take a moment to go back to that. When I became the interim chair, I had the same concerns. I certainly didn't know many people. There were a few that I knew very well. And we were all struggling with the reality that we were doing these things on Zoom, and it just was a kind of a depersonalized world. And unfortunately, when we had our live meetings, there really was just a few people who showed up. And so we also were limited a little bit. Hopefully moving forward, and once we feel that it's a safe environment and we can do this live, I think it's a good idea. I have been on other boards where you did feature a member. The only problem with that, it'll be then 20 meetings before we get to know everybody. So I think what Sybil had proposed was actually try to do this a little bit more kind of efficiently. And so if we do devote a meeting to it, Mike, that could be a way of kind of letting to know everyone. And the other thing is that we'll give everyone a chance to kind of collect their ideas, and we'll probably, I'm going to suggest that we have you submit them, and not like when you applied, because as we pointed out, when a new member applies to the board never sees that application. And so when a new member is on the board, we would probably like them to share the same information with us.
And Dr. Lynn, since I started here, I have received the applications for those individuals that have started, but I had put a request in this morning to Vicky Varga, the mayor's office, to get everybody's applications. And just because I want to take a look at everyone's information, like I'm going to pick on Jan, like here's her application right here in front of me, because she's one of the newer members, and I can look at this and see that Jan has 40 years of administrative experience in hospital settings, including medical records at Weiss, and I have her background. I just have to be careful with, I'd love to share this with everybody, but I don't really know if it's something everybody would feel comfortable with me sharing. But I certainly think that this could be used as a template, where we maybe, if everyone's comfortable, we can collect information and then share it as one file within the onboarding document.
We have to work within our policies, procedures, and follow the legal course. To remind everyone, because of the Open Meetings Act, these meetings are open to the public. And again, I think we have to decide what is appropriate to share with the public and what is appropriate to keep confidential for the individuals. And so we're not publishing these documents. So we have to work on this. So I'll say that we will table the introductions. Sybil, is that okay?
Absolutely.
And that we will at a future date we'll try to actually have an agenda very much dedicated to this. And I kind of like Mike's idea of maybe making it more of a casual informational meeting, and again try to get to know everybody. And just as we move off this topic, though, I can vouch for Jan's credentials because I have many years working with Jan, so I know the qualities and capabilities of her leadership. So again, thank you everyone for your concern on this topic. So we're going to move on now to our educational. That was another thing I tried to achieve, was to make sure that I call it board development. So we try to have an educational program about what the Department of Health and Human Services does, so that we can be in a better position, because our charge is to be a resource to Health and Human Services, to advise to both the department and specifically Mike and the mayor and the Board of Trustees regarding this particular issue of healthcare and well-being in our village.
Right?
You got it.
Yeah, okay. So the next item on the agenda is for me to present some information about the Health and Human Services Emergency Financial Assistance and Assist a Family programs. And these are two programs that have been around for a while, but they were on the human services side of Health and Human Services. As some of you may remember, at one point we had a health department and we had a human services department prior to me getting here. And I think within a year or two of me getting here, they combined Health and Human Services. On the human services side, we have some human service advocates and a social worker and a couple other staff that work on these two programs. So I wanted to start off with talking a little bit about emergency financial assistance. So this is something the village provides. It's financial assistance for those individuals that are income eligible. Their family household income is within 165% of the federal poverty level. And it's helping them with unpaid utilities, past due rent or mortgage payments. And what we do with this program is when the public needs, when Skokie residents need assistance with any of those things, they go through an application process where they fill out an application and the application gets reviewed by some of our human services staff. And if they meet the qualifications for this program, then we really very quickly, usually because they need the money immediately, we will then allocate up to $1,500, $1,500 to that individual and family during a single calendar year. Within this program, within the last, since November 1st of 2021, we've helped out 91 families or individuals and distributed $87,250. And that's through October 31st. You know, I mean, I signed off on a couple checks today. We do work collaboratively on this program with other agencies. And when I say that is that there are different agencies in this area that do provide for emergency financial assistance other than the Village of Skokie's Human Services Division, including Niles Township and like Connections for the Homeless. So what we can do is if somebody owes more than $1,500 in past due rent or past due utilities, what we do then is we work collaboratively by reaching out to the other agencies and then partner to consolidate our monies to assist these individuals. Speaking of this program, I had a really interesting meeting with Connections for the Homeless this morning at their home office in Evanston about their emergency financial assistance programs. They're seeking some additional monies. They have flex funding too. So individuals that to prevent homelessness, just say like this, one of the stories they told this morning was like an individual that their car broke down and without a car, they couldn't get to work, and without getting paid, they were going to be past due on their rent. So they end up giving families up to $500 for flex funding for things like gasoline or I don't know if I could provide too many other extensions, but they did get $9,000 from the Skokie Community Foundation from that a year ago. So we do work with other agencies in town about emergency financial assistance. For Assist a Family, so this is a program that's been going on for a number of years. Every year around the beginning of November, maybe mid-October, we push out information to the Skokie community asking for donations for this program. Over the last 2 years, not counting this year because I don't have the numbers on it, but we collected about $125,000–$30,000, which is an amazing amount of money. It's just the generosity of the Skokie community is just amazing. And what we do then is we take the money that we get from Assist a Family and we use it for EFA and we use it for this Assist a Family program. And what happens is individuals that and families that we've helped over the last calendar year, and we know that they're struggling financially, we will reach out to them. We will communicate with them that we have this program, and they submit a small, well, individuals that we've assisted over the last year, they don't need to submit an application, but we also accept new applications from individuals that may be struggling. And what they do is we then select the families, and during the month of December, we pick a couple dates, and people will be coming to Village Hall here to pick up gift cards. And the gift cards are meant to help these people financially with groceries, with things that they really need for the holidays. So it's an amazing program. A lot of amazing families that are really helped out during the holidays, and it's 100% funded through donations. And I wanted to thank the Skokie community for doing that. And I think I have our last holiday season, we helped 154 households, which included 332 children and 309 adults. It's the same, hold on. Oh, and then how do you donate? So individuals, including Board of Health members, if you're interested in donating, you can donate via our website by visiting our website, and there's a link on our website where you can click on it, and it just walks you through the payment process. Or you could send a check in to the Health and Human Services Department, and we would process that check and make sure that the money gets into the correct account. So 2 great programs that we offer here in Skokie. Does anybody have any questions about the programs? Okay.
Is there something that we can be doing to help get this word out? Either on the donations or the alerting side?
Well, yeah, I mean, if anybody works for any organizations in town and you're interested in sharing information about it, or your fellow residents, but we do push out the information in the new Skokie and the Skokie News. I mean, you know, we do push information out about the program to residents. So yeah.
Before Bill raised his hand, but Maureen put a question in the chat, and I want to make sure the question is read so that it gets in the recording. And here, I'm sorry, Pat Urbanis, I apologize. I wasn't looking carefully. Pat wanted to know what the average gift was, if you knew that, Mike.
I don't know that. I don't know that information. I mean, I could tell you, but it would take, I'd have to respond maybe at the next meeting. I mean, I could look to see what the average donation was.
And Bill, you have a question.
Yeah, actually, I wanted to say that every year we get a mailer about this time asking for a contribution.
Yeah, we do send that out.
Yeah.
To individuals who donated the year before, we'll send them something. And then we also send a thank you letter afterwards. So anybody else have any questions? If not, should I transition into the next item, Dr. Lynn?
Yes.
Which
So
is,
your
okay.
report.
Okay, so COVID information. One of these days, I'm not going to leave with COVID, but essentially, if you look at the graph, which I'll show you in a slide or two, we've sort of plateaued in Skokie with cases. I don't really think it's been that much different around the state. You know, we may have seen a small uptick, although they are predicting an uptick in cases this fall, and we'll see what occurs. But when you look at our graph, you'll see that we've sort of plateaued, a little slight decrease over the last week or so, but some of that may be just because some of the labs may still be slow with their electronic reporting of cases. Again, I mean, we all know that the real deal with the testing now is that, let's face it, a lot of people are testing via at-home antigen tests, and none of those tests get picked up. So it's so hard to compare the data now to, let's say, a year ago or even 6-8 months ago. But Skokie data has sort of plateaued. The community level for Cook County, which is the CDC's measurement of your risk for COVID is still low in Cook County, but many of the counties around the state of Illinois have actually seen an increase in their COVID level. And that COVID level is a measurement of the community transmission rate, which is how many cases over the last 7 days you've had per 100,000 population. It also includes hospital admission data. And essentially the CDC level, if hospitals, I think, have under, I think it's, I should have wrote this down. It's like under 10% of the hospital beds are only available on a, but there's different metrics they use. Right now in Cook County, we happen to be a high transmission rate, but we still have some hospital bed availability. So right now we're not medium or high, but again, your risk of COVID now, especially if you haven't got your bivalent booster, is probably as high as it was a year ago. It's just that with the therapeutics and the hospital rates decreasing because of that, and the boosters, your risk of having severe illness, unless you're immunocompromised, just isn't as bad as it was, or you're not as much at risk as in the beginning of the pandemic. Our community transmission rate has actually decreased a little bit since the last meeting, but we're still at a high community transmission level. And I just want to throw this out there. The iCare data through the end of October showed that we had about 11,345 residents that have received their bivalent booster, which is about 18%. At that same time, I know that like the city of Chicago is just under 15% of eligible people. So we're higher than Chicago. I don't really know how it compares to the state of Illinois, to be honest with everybody at this point. I feel like I'm bouncing around here. Some other updates. We're still administering Moderna doses, although the October clinics for the bivalent booster filled like right away. The November clinics, we have space available for the bivalent booster. So anybody you know who hasn't received it and wants to come into Village Hall, certainly refer them to us and they can schedule an appointment online. We have administered 34,000 doses of COVID vaccine. We've had about 21,558 cases, which is just a crazy amount. According to the data I have, we're still at about 210 deaths. We haven't had any deaths recently, or not for a while now, which is great news, right? We certainly, if I don't have the curve for that, but in the beginning of the pandemic, that's when we saw a majority of the deaths. But because of treatments available to the public and vaccines, we've seen a significant decrease. And we did administer about 1,000 flu doses at our 2 community flu clinics on October 6th and October 12th. This is a chart of daily COVID cases from the beginning of the pandemic through today. As you can see by looking at the bottom here, we've sort of plateaued since the first week of September. And we see a small dip here, but I always caution the last week's data because I've seen where I go to iCare a week later and there's more cases reported just because of slow electronic reporting of some of the labs. And this is just the transmission rate. So anything in red is high. Of course, this was the Omicron surge back at the end of last year. Other updates. So we have an iPlan collective impact meeting scheduled for next Friday. I know that I will be there. I know Sybil will be there. But we tried to, get a well-rounded group of individuals. I think they're seeking about 60 individuals from different organizations. I mean, we will be identifying 3 priority items to work on over the next 5 years with the entire community at that meeting. We still have asylum seekers housed in Skokie. I met with the Department of Human Services and the agencies working on the site last week, and they said that at this point, all of the asylum seekers' needs are being met, their basic needs, and that they're doing well. I did present to the village board on seasonal respiratory illnesses, COVID-19, flu, and RSV on Monday. It was a very short presentation, about 6 minutes. The reason I presented was that, and I think Dr. Lynn may have already went over a lot of this, but the health department has received several, they're called sirens, and I know Dr. Vernon would know what those are, but sirens, maybe some of you medical professionals might too, but siren releases from the state saying that because of the different seasonal respiratory illnesses, that hospital beds are of a premium now. And that's a concern in certain areas of the state. So that's something to be aware of. We are having a blood drive on December 1st from 1 to 5 here at Village Hall down in the community room in the lower level. I looked right before our meeting today and there's still spots available. I am donating blood that day. So I invite anybody interested. You could go to our website and I believe there's a link there. If not, email me and I'll get you the link. We have a new employee. She started Tuesday. We received a disease investigator IDPH grant, and we received $300,000 over a 3-year period, and we were able to hire Amy McManus. She has a background in communicable disease, or her responsibilities will be communicable disease surveillance, data analysis, reporting, outbreak response, community stakeholder meetings. Should be involved mostly with communicable disease and communicable disease management for the village. And her background includes working with HIV screening, linkage to care, HIV research, STI counselor, and education. So she has a background with communicable disease, and I think she's going to be a great employee for the village, at least for the next 3 years. And that's my update for tonight. Does anybody have any questions?
Swap has a question and I have a comment. So Swap.
Okay.
Yes, thank you. Mike, thank you for that presentation. I just had a question. I have a couple of family members who asked about vaccinations and kind of the appointments being full at the village. I guess what's the best way for people to schedule? Is it online or calling the village?
Either or. If you want to schedule, you can go online now. And at least earlier this week, we had appointments still available in November right now for bivalent boosters. But you can also call the 847-933-8252 number. I can put that in chat, and we can help you. We can register you, online, but through us. More than happy to help.
Okay, thank you. I'll let them know.
Yep.
So going back, Mike, to your data on the booster and the rate in the village, we're actually quite similar to the rest of the state and the national level, and it is very substandard. When you pause to think about it, everyone who's eligible for the booster had to have the primary series of vaccines, which are vaccinated people. And we were at the 80 plus 90% rate, not coming back for the bivalent booster, and it's a big mistake because there's new literature and it's coming out every week showing that there is a waning of at least humoral immunity, the antibodies. Cell-mediated immunity is still being investigated. We think there is a little bit better long-term cell-mediated immunity. But everyone needs to get their vaccine to renew their immunity. And specifically because we now have a big problem. So this is the good news and bad news. The good news is the disease the variants that we're concerned about, BA.5 is dwindling. That was the big one of the Omicron variants. And now we have the 1.1 and the BA.1 and the BA.1.1. But across the world and in the United States, it appears to be a relatively mild disease. And that's probably because of the immunity wall. So we have a lot of people who are vaccinated, millions of people, and we have a lot of people that caught COVID. The ones that took the toll the most in terms of mortality was losing about 2,500 people a week in the United States. from COVID deaths. We can't get complacent about it. And I kind of I dwell on this all the time, that people need to renew their immunity because these new variants, we're losing our therapeutic edge. Right now, Paxlovid's holding up fairly well, but Betilimumab, and I always have a hard time saying it, is not there's an immune escape with these variants. So that drug cannot be used anymore. Evusheld, which is the combination of antibodies that we use in immunocompromised people, will no longer be effective against these variants. So the only thing we have in our armamentarium is vaccination. So I know Mike, every day that I read, or every time I read the mailings that come out, the emailings and the mailings that come out from the village, he emphasizes this in this. Whether people are reading it or understanding it, I'm not sure, but please be advocates, to anybody that's in earshot, just remind them. And, now's a good time, because when you're making plans for the holidays, say, well, have you been vaccinated and boosted up to date before I invite you over? Maybe a reasonable strategy to encourage everyone, and same thing with influenza vaccination. So any other questions on the point that Mike, the data and the information that he shared? Not hearing any, I thank you, Mike. And we'll now move on to Heidi to do a little bit of an update for us, about the onboarding process that she and her committee is working on.
Okay, thank you so much. And I will say, through no fault of anyone's except mine not being able to find the list in my email, I missed some people. I think like Dr. Warner I think you had said that you would like to help participate. And so I apologize that I haven't gotten a hold of you to date. I know Maureen is interested in working on this. So I'm going to share a document, and then Mike and I had an email exchange earlier today. We'll be able to share this more widely for everybody's input. So is that all right if I share, Mike? Okay. And I know this is a Word document, and I'm not expecting you to read every word, but I just want to maybe go through this as a broad outline. I really feel this is more of an outline of a packet of information for onboarding. And so Sybil and Swapna and I met most recently about this to kind of beef it up a little bit and create some comments and action items. So I'm imagining, although the mayor sends out a letter, that there could be a letter from our chair and Mike or the board leadership or something, welcoming the new commissioners and introducing them more to the work of the board. What's been happening this year. The purpose here is literally taken off our Village of Skokie website. The Board of Health advises the mayor and board of trustees about public health needs and concerns. They recommend specific environmental improvements and provide consultation about current problems. Committees are created as needed to propose actions on important issues. So I guess this is a little committee. The Skokie Municipal Code I included, there's a reference to the state law defining and setting the parameters and scope for the State Board of Health. And then literally the Skokie Municipal Code sections on the Board of Health. So we'll share this document and please do read those. Some of this is opinion and none of this has to stay. I think it would be fair to have a statement of conduct and ethics, and some of that is confidentiality, some of that is conflict of interest. And I'm assuming that the village has something like that, or something that we could work out if we all agree that this is an important thing to have. Required training was a bit of a, Maureen, oh, Mike, could you just mute her? You can probably go over her picture and, okay. Required training is by no means complete and may not be correct anyway. But in the course of my discussions, it became clear that not everybody has had the Open Meetings Act training. I haven't had it for 10 years or something like that. So I'd love a refresher. Mike has that link for us, and we can put it in here, maybe Mike too, but also send it out. So the village does need a record of our training on that, maybe a HIPAA refresher for some folks. I think it would be helpful to have an introduction to village business, either attend a trustee meeting, meet with our own assigned trustees, something, because we are a cog in a much greater wheel, right? We don't operate in a vacuum. And certainly an introduction to the Department of Health and Human Services staff and programs, maybe have a tour, introduction to the projects, the budgeting, things like that. Mike sent me a document of, I don't remember what it was called, Mike, and I have it here. I can share that also, on all the service areas that his department covers, and it's stunning. But that is not something I got when I joined the board, and I think that would be really helpful too. So we talked about surveying either other boards and commissions to see if they already have something like this, so we don't reinvent the wheel, we just modify the wheel for our car. Or maybe the village has something that, you know, they have for something else that we could maybe use. So it's funny, I had this in here, and Sybil said one of the things that would be really great is a calendar and kind of a schedule of events, and maybe have that be another way for Mike to share with us opportunities for service. Like, maybe I'm interested in volunteering for one thing, and we know that in October there's the flu clinics or whatever. So kind of that rough calendar churn of events where we might be able to lend helping hand or skill or expertise or whatever is needed. And then we talked about this earlier today, the board members' bios, contact information. You know, we felt it should be an opt-in, but there's a little bit about all of us that has already made ourselves public by wanting to be on a public board. So I hope that we could find some, you know, I'd like the sort of a version of our application to the board with an opportunity to update. Mine is sorely outdated, and probably some of yours are too. But a way to get to know each other better, and an introduction right off the bat to new folks about who we are, and maybe what you all were mentioning earlier, what is that passion that brought us to want to serve on this board. Sybil brought up the onboarding buddy. I would have welcomed sort of a more experienced member of the board to just kind of walk me through a couple meetings. But, you know, that could also be an opt-in, and certainly departmental contacts and other important links, whatever those may be. So we did think, surveying other boards and commissions, we can chop up that after talking to Mike, of course, then we could chop up that list and reach out to the chairs of those commissions, or Ed, that might be something you want to do, and send a letter as a chair to other chairs. And maybe you could help us that way. So Mike did say it is okay for us to put this on Google Docs to get input from everybody. So I didn't have time today to do that, but I will do that, and we'll send out a link. And then I would be happy, anybody who has any trouble accessing that, I can either walk you through it, make sure you get the document another way. We'll, everybody has the opportunity to provide some feedback and input on this. And then I already mentioned the Open Meetings Act training. Mike sent me a link, and we'll make sure that everybody else has that. So even if you've done it and you'd like a refresher, you'd be able to do that. So let's see, there are some comments in the chat. I don't know. Oh, thanks. Oh, great. Thanks, Mike. And I don't know if you want me to share that other document or not, but I would welcome like off the cuff input on this. This is not my project. It's our project. So any off the top comments and
So Heidi, I would like to first and foremost congratulate you and your team members, because I think this is not just a start. I think this is outstanding. And I think you've touched on a lot of critical points, because as one of the newer board members, I too struggled with a lot of these things. And I was very fortunate that I chose my mentor in Dr. Werner, who I knew, and I still seek advice from him, and it's very helpful. One thing in terms of training, and Mike can maybe emphasize this, I know I had to go through what they call seed training, like all village employees and all members of commissions. And this was a long commitment. It was months of training in topics, equity, equality, harassment issues, and that was required by the village. And Mike, do you know if everyone has received this training, or as the newer members, because it didn't exist when the older members, and how we play catch up ball on this? Because I think it was a village requirement.
I don't think so. I have them. I think the seed thing is sort of an optional thing.
I wish I knew it was optional.
So I know the village sends 10 employees a year to it because we pay for it. But I have the letter right here from Vicky, and I don't know. I don't think that I don't think it's required, Dr. Lynn.
Gee, I wish I knew I could opt out, because I had that training through my medical activities ad nauseum, so I could probably teach the course. But well, good if it's not required, but it is an optional thing for those who haven't been exposed to it.
I do have
SEED.
Yeah, I don't know what the acronym stands for.
What is that right?
Yeah.
Okay.
I haven't seen them, but I have a couple comments for Heidi.
Great.
Just updates. So I went through this when you sent it to me, the statement of conduct and ethics. There is a statement in the ordinance about, I'm trying to find my notes now, but there is something in the ordinance about it, hold on. I got like a million things open on my desktop here. So there is a section of the code that talks about all state of Illinois and village rules and guidelines concerning conflicts of interest and ethics shall apply to all boards and commissions, chairs. There's a small little blurb in it.
Great.
And I did check with my HR director, and I'll circle back with the mayor's office on just clarifying that.
Okay, that's awesome.
The information that goes out regarding Open Meetings Act training, I have a letter from Vicky Varga. This letter she sends out, although I will send out Open Meetings Act, the link. If anybody hasn't done it, you can just go ahead and take it. And then you print the certificate up and you can send it to Vicky Varga or myself, and we'll make sure it gets filed here. Department contacts, I'll give you a list of department contacts and an org chart to put in.
Oh, great.
And then, yeah, I think that's it. So, but I'll help you with all of this, put it all together.
Additionally, I think that we should make sure that everybody, has had the opportunity to do things that they haven't done before, and to make sure that everyone feels comfortable that they're kind of up to date, with all these requirements. I think the Open Meetings Act is it's not that complex, but I think it's important to understand it because it does govern how we conduct ourselves in terms of the size of subcommittees. Because if you go beyond a certain percentage of your quorum of your membership, you would have to open it up to the public, and it becomes a little bit more of a complex scheduling situation. Anyone else have any questions?
Swapna's got his hand up.
No, I
Yes.
see your hand. Thank you.
Sure. I think, I can't remember if we signed any conflict of interest when we joined the Board of Health. I think when I'm on different boards, I've had to sign different conflicts of interest. And I wasn't sure if I couldn't remember. Mine was 6-7 years ago. But that could be something
board that
to consider.
every board that I've been on, you have to do it annually. And
Right.
because your conflicts change. And many you actually have to declare. They have a very rigid, Mike, I don't know if employees have to do that, where they actually have you report. And I've worked for governmental organizations where I've had to do it to 3 or 4 different entities on an annualized basis.
In Cook County, you have to do it.
That's what I'm talking about.
Yeah, we have to do it every year. Every year we have to submit our statement of economic interests or something like that.
Yeah, and that's for employees. And I don't know whether they apply it to board members, but I have been on boards where you have to, do this. Any other questions?
Well, I'd certainly like to thank Sybil and Swapna for stepping up and helping with this, and apologize to Dr. Warner and Maureen and whoever else's name I missed for not getting you in on this first round. But please don't let that stop you from helping make this better.
I'm not discouraged, Heidi. Count me in.
All righty. Thank you, Maureen.
Yeah, me also.
Great. Perfect. Thank you all very much.
I'm just checking my agenda. We're now open to public comments. Are there any? I don't know if anyone is on your link, Mike.
I can, hold on, let me check one more time because I checked at the beginning of the meeting. Now there's nothing. Nothing.
Okay. Is there any other business that the members want to bring before the board? So I thank you all for your patience and your understanding. I really think this was a productive meeting, and I think we've accomplished a lot. And again, I can't thank Maureen and for her timely suggestions and her openness to share some ideas, and Swapna, Heidi, Sybil, for your efforts. I think this is wonderful. One other thing that I would like to just say, Mike and I talked about this, and I don't know, Heidi, if you want to include this in your packet, but I think every member of the board should be aware of the Medical Reserve Corps. And hopefully every member of the board will consider joining it. The Medical Reserve Corps was an experience that I will never forget. It's one of the highlights of my career because I saw all these people. Dr. Werner will attest to it because we were often rolling up our sleeves together and taking on a huge challenge. That the village was faced with because of the pandemic. And, I think that we should all know about it. And I know that, Mike, they're starting to now have quarterly meetings again from the Medical Reserve Corps. And these are educational. But I think we also have to think of the Medical Reserve Corps under the Board of Health evaluation of the plan. Because that is a resource that the village will need to rely on in case we are faced with another healthcare emergency. Anyone else have any other comments about the MRC? Sybil, can you unmute?
The MRC is for clinical people. I believe is the way that it's viewed, and there are members of the board that are not clinical and may want to consider how they can contribute. And I think I would like to see if we could figure out how to have that conversation.
Yes, that's important, and again, that's why my discussion with Mike. Offline before the meeting, we were talking about the MRC the other day. Bill has his hand up, and I'll get to you in a second, because we did find, like at the mass vaccination clinic and the functioning of the Health and Human Services office, there were many people that didn't have clinical backgrounds, but they had good, solid administrative or clerical backgrounds that was also very needed. So we may need a parallel if MRC is only for people with clinical backgrounds, and that's a broad definition, because as Mike and I were talking about, we desperately need people from the village that are have expertise in mental health. We may have to cultivate kind of a parallel reserve corps, if you will, because these are services that are very needed, and there may be a lot of volunteers who would be interested in that. Bill, your hand went up.
Yeah, as I recall, the MRC is under an umbrella of a national organization and requires that the members be licensed medical professionals. So I think this idea of setting up a parallel, whatever we want to call it, administrative corps, has a great deal of merit, because again, as we discovered with the mass vaccination clinics, there are a number of roles that people could play, and they don't have to be a clinician.
Jen?
Well,
Or should I say Steve?
I just want to say, isn't that kind of like the emergency preparedness drills we've had at hospitals, where the administrative people were doing a lot of the calls and different things, that contacting the physicians or whatever?
Well, we're absolutely 100% correct. And that was an analogy that I previously discussed. I don't want to get too far ahead, because this is something that we're going to have to really focus on in more detail, because that is a request from the mayor, that he would like the board to kind of look and see what we need to do to be ready in case we have, whether it be mass casualty, another pandemic, all the things that hospitals are required to pay attention to. And so, and again, I just think there's a tremendous amount of of people who are interested in volunteerism and a lot of talent. And I think that, we saw this in action, and that's something that we'll be moving forward to. And this will be, I believe, a good project for the board. I said, I don't want to get too far ahead. We have to think this through a little bit. Any other comments or questions? I'm looking around to look for hands or things like this. Well, I don't see any, so I'll entertain a motion for adjournment.
I so move.
Anyone want to second it?
Second.
So we will vote by watching everyone click off.
See you guys.
Okay.
All right.
Have a good night.
Everyone, everybody.
Everyone stay
night.
well.
Good
Have a
night.
happy Thanksgiving.